So my name is I'm from Poland. My first degree is medicine. I'm a medical doctor with training in clinical pathology. And then I am also, I have a master's degree in medical education. And this is what I will be talking also about, how much we need it. So at a certain moment of my life, I decided that I cannot combine both practicing medicine and medical education. And I decided that I would switch totally to medical education. And I think this was the best decision in my life. So my head of the Department of Pathology, he met me recently and he said, I think he expected different answer, because he said, so are you happy? And I said, this was the best decision of my life to leave you. And I love pathology, but just you cannot be good into fields. So this will be one of the issues I will address. That for many, we are not very numerous here, so I would like to each of you to very shortly tell where do you come from, at least. And I think we really need, especially if we want research, we really need people who devote their lives to medical education, because we have a lot of colleagues who are also at my university, who are perfect clinicians, nephrologists, with big interest in health professions education, but this is not exactly the same. So can you just tell everyone, where do you come from? Yeah, who are you?
I'm representing the University of Plymouth in the United Kingdom, but I'm born in England. And I'm very glad that the concept of widening participation and inclusivity that you touched upon is being discussed, because when we talk of sustainable development goals, is it okay if I talk? We are now in the almost finishing 9 years of sustainable development goals. We have only 6 more to go. And when they were coined, just like the speaker there, I think Professor Adel said, there was a promise not to leave no one behind. But there was also a promise to reach for the furthest behind first. And we are not doing that. And education is a great leveler, especially healthcare education. We can empower entire communities. But if we see the world where invention is happening at a pace, but its fruits are limited only to a few people, it means we are creating inequity. And by virtue of that, we are creating an unhealthy world. We are becoming more unhealthy in spite of all the innovations. So unless, just like we focus on, medical ethics, when we talk of autonomy, beneficence, maleficence, and justice, every time we create education, especially in health, unless we commit ourselves to testing, is this really reaching the furthest behind? I think we are creating an unequal world, which makes it inequitable and in the longer run unsafe.
Good morning, everyone. My name is Peter Törzsök. I'm from Hungary, from Győr, from the Széchenyi University. But I'm a clinician as well. I'm a urologist and an andrologist, and I'm very happy to be here and discuss this topic with you.
Yeah, thank you very much for the opportunity. I'm Peter Németh, also from the Széchenyi István University from Győr. I'm the scientific secretary of the university, and I am open for every research and education related topic. Thank you so much.
Good morning, my name is Daniel Mány, and I'm not a medical doctor, but I teach at the medical university. How this could happen, because I'm here to represent the Institute of Languages for specific purposes. We have an institute here at Semmelweis University, and we teach 7 different languages, all for medical, dental, and pharmaceutical purposes, namely it's English, French, German, Spanish, Russian, Hungarian, and Italian. I'm also a medical translator and interpreter, and we offer here at the university a postgrad training for medical translators and interpreters between English and Hungarian and German and Hungarian. We also carry out research activities, of course, at the institute. Thank you.
Hello, hello. My name is Attila Horváth, and I'm representing the industry here. So I'm from the pharmaceutical industry at Sanofi, but my route in this medical school was I taught physiology almost more than 20 years ago. Yeah.
We are from Kazakhstan, Karaganda Medical University. My name is Anar Turmukhambetova. I'm a radiologist in my first life, but now I'm a rector of Karaganda Medical University, and we're happy to be a part of the ranking this year. So this is the first time here in this event. Thank you.
Hi, I'm Hannah Peacock. I'm not from a university. I'm from Tynes Higher Education. I work on the sustainability rankings that we do, and research is a big component of it. So I thought it would be interesting to attend.
Hi, my name is Esther Rocco. I'm from the Semmelweis University, the Clinic of Neurosurgery and Neurointervention. I'm a fourth-year resident, and I'm also doing research in using AI in stroke management. Thank you.
Hi, I'm Dr. Shabnam Sarfaraz. I come from Pakistan, and I've worked at the policy level. I worked for the Prime Minister, and I was leading Pakistan's health, education, and gender portfolios. I worked as the health workforce advisor for WHO at the EMRO office, and for the health workforce strategic framework, the human resource for health profiling, observatory. So I have been on the policy side. I'm also editor for the BMJ. They've done a special edition on health workforce research together with 3 professors. So very interested in the topic that you have here.
Hi, I'm Gabrielle Finn. I'm Associate Vice President for Teaching at the University of Manchester and Chair of ASME, which is the Association for the Study of Medical Education in the UK. I'm researching widening participation with my PhD students.
Hello, good morning. I'm Luciano Saso. I'm a professor at Sapienza, University of Rome in Italy. Very much interested in the topic today, especially in health professions education. I'm active in some university networks, so I'm here to listen and to learn.
I want to start from just asking everyone to realize that even if you are from distant countries, we are all super privileged at the top, because we knew about this conference and we could find money together. Because very often I can see advice given to people from, let's say, underrepresented regions. Well, you need to hire a professional English writer. You need to use the editorial services. No, I have no money for this. This is not that easy. If you are telling this, it means that you don't realize the situation. I'm sorry, I will need to look at the screen. So you may know, you may not know Medical Teacher. This is one of the 3 top journals in medical education: academic medicine, medical education, and Medical Teacher. It has very specific profile because of these 3. This is most practical and designed just for frontline teachers, while the other 2 are very theoretical, extremely good journals, but more for people who are professionally dealing with research in health professions education. So we are open to all health professions. This is really important. There is a problem with the name, because the name is very well established, but it's not only, it's medical from the perspective of medical science. It's not medical doctors. And all levels of the continuum of education, from undergrad to postgraduate and CPD. And this is the Journal of AMI. I don't know if any of you attended AMI conference. This is I think the most important conference globally, with 4,000 people now joining in Basel a few weeks ago. I just want to share with you that somehow it happened that I'm the president-elect of AMI. I was just elected a few weeks ago, so I feel the responsibility and I said that my main goal is bringing people on board, because we are often talking about listening to weak voices, but some people have no voice at all. Because, for example, if we very often, when we discuss AMI conference, we list, oh, we have only 1 person from this country. Okay, but there is 1 person, but there are many countries that there is no one, and we need to somehow empower them. So
This is just, all the dots, it's more or less 3,000 submissions a year we get to medical teacher. We can publish only about 200 articles and 400, because the text publication means because there are invited letters, there are some reports and so on and so on. So this greenish part is what we can publish. And now look, what is the responsibility? Really, I'm the associate editor of medical teacher. I feel this responsibility for not only for choosing the best one, but for rejecting those which do not qualify. So we get from editors, from the publisher, extremely detailed data. So we get, I think I will just stand here. So we get data on what were the most downloaded papers by country and region. We get impact factor. We analyze our impact factor, what's going on every year, every half a year. We know what are the top popular articles. This is really important to identify them. And for example, I can tell you that still it's 2024, but the most downloaded paper is from 2020. Who is citing us and from what region people are citing us? Then, of course, comparing how the other journals do. This is just, this is about sort of competition. And there is the altmetric analysis that I will tell you a little bit more, which is focused on social media. It's a much more contemporary way of analysis. So I don't know how much you know the altmetric system, but this system for every paper published now in, I think, majority of research journals, they get this donut, altmetric donut. And now look, the donuts can look differently. So first of all is how many mentions you get, but also the color of the donut indicates what is the category of mentions. So this blue donut indicates, for example, a lot of attention on Twitter. This is attention from blogs and public policy documents. This is the mainstream media. This is really important for also for the authors to look who are the people that are reading, that are quoting you. And this is an example again of our 12 of our top altmetric scores for past years. This is not past year, it's for past years. So now we are very careful about geography of submission. And I need to be very clear because there are a lot of people who say, oh, they reject. I'm from Poland. Of course, we are still privileged because we are in Europe, European Union, but still, there are people telling in Poland, in Czech Republic, probably in Hungary, well, when they see the paper from Poland, they will just look at this like second-class paper. I promise you not, on the opposite. Of course, we are not pushing everyone, but when we see the paper from the country that rarely publishes, I'm 10 times more careful just to discuss it with the editorial board to be sure that we will not skip it. So this is the first message, that just don't be afraid, and I will have a slide on this. However, it's very complex because we need to know what are the countries that submit to us, but how does it translate to publication, and who downloads. So geography of submission, I had to apply for the special permission to show you the slide, but I got this permission. I was thinking that I will need to cover the countries. So now look, USA, China, United Kingdom, does it translate into publications? Not really, because, for example, we don't have that many publications from China. It's a long list. You can see Germany here, but you don't see Hungary, you don't see Poland, you don't see Czech Republic. And sadly, I have to say that this is my second year as associate editor. I haven't received any manuscript from our region. So this is not, so for some countries, it is about that they do not submit. For some countries, it is more why they do not get published even if they submit a lot. And I can understand certain mechanisms that I will not discuss to greater detail, but I know, for example, why there is a certain country that is suddenly starting submitting more, because there is, for example, a very famous visiting professor that encourages them at the university to submit, but not necessarily supports the research. So they telling you submit, submit, submit. It's not the same as you will get published. So this is another issue. If the main countries to download are UK, USA, Australia, Canada, Netherlands, so now we need to break this vicious cycle, because we want, if we publish from Central Europe, Central Asian republics, from South Africa and so on, we also need to somehow stimulate that these countries download and read it. I'm not telling that the paper from South Africa is only interesting for South Africa, on the opposite. But this is a very complex system. I'm a great fan of systems thinking. I will not bother with this. But there's not one factor that will break this vicious cycle of underrepresentation. Now, I need to clarify. We have colleagues from Pakistan. We have colleagues from Sri Lanka. I'm not a great fan of telling global south and global north, not because there is a huge disparity, but some people, some of my colleagues, even from these countries, they say that it's labeling, like the first class and second class. And it also excludes many countries which are similarly underrepresented, like Central Asian republics, which are theoretically global north. So, however, we made this analysis, and you can see a lot of submissions from certain countries, but also a lot of rejections. And my friend Rashmi Kusurkar, who is also an associate editor of Medical Teacher, she suggested this leaking pipe of why there are submissions and why we do not finally publish. So I will discuss it in greater detail, but just again, for some countries, there is a lot of, the production is high, but the publication is not really high. But there is this sentence here is very important. Knowledge synthesis, which means systematic reviews and analysis. They are practically all produced in the northern countries, in a few northern countries, while, first of all, it should be based on international cooperation. Then it does not require specific financial resources, secondary research. And I'm encouraging people, just form, if you are good in virtual reality, form a team from your university, invite colleagues from Chile, invite colleagues from Ukraine, and form a team to develop a systematic review. So there are numbers and there is quality. And just as I said, it's not enough to tell people, submit more. It's not enough to tell people, download more. We need to address it in a systemic way. So now I will share my pains. So knowing this all, what does a good editorial decision mean? So we have a really strong editorial policy for Medical Teacher, which says that we are aiming at achieving representation from all regions, but also to present the perspectives of the countries, the perspectives of all regions. Another problem is, let's be honest, very often now authors from well-publishing countries invite a person from the global south just as a cherry on the cake. And then very often these people do all the job, but then they are published just in the middle somewhere. And I had a huge fight. I will not tell you the conference, but I was very critical when there was a presentation about reducing disparities between countries made in cooperation with Africa, but the presenter was from the USA, I think, and then the presenter was telling all the time how important it was to involve the colleagues from one of African countries, but the colleagues were sitting there and they were not participating. So this needs also to be fixed. So we need to be very careful about acknowledging, recognizing what was the input of all people, but then there is a need for this support for people who do not publish, who are underrepresented. I very strongly encourage you to download. You can take this. I don't know what happened to references, but if you can take a picture of this, this is quite old. I think it's about 2020. But there is a one-pager. I have it, but I don't think we'll have, if we have time, we'll be back to this, giving the quality criteria for the publication. And this is really helpful. You go through this, every point, just as I said, I will show you, and at the end, I know, at the end I will have references, but if you just search it in PubMed or even if you Google it, it's a beautiful graph. So I was also happy to hear about Sustainable Development Goals. This is what is also important for us, that you indicate when you submit that you are not only touching, that you are not thinking education for education, that you are thinking education for reducing poverty, education for supporting environment, and people more and more present. I was so happy that I had this pin, and I could give it to your Hungarian iconic professor because she was also talking about this. So if you see that she's wearing this today, so she got it from me. So how does it look like for the journal from my perspective? I read more or less 10 new manuscripts per week. I'm the part of the team of associate editors. And I also get accidental. So they are just 10 forthcoming papers, manuscripts. And then I have some narrow expertise. So if there is something difficult in the area of especially diversity, cultural competence, I also get it. I read them very carefully. I'll make a documentation. I will show you the documentation. And then we have weekly editorial meetings. And then we decide, this is still between editors. Do we have the capacity, does this paper have the capacity, the strength to be sent to reviewers? You have no idea how we struggle with reviewers. I have papers, if you submit and then you wait and after half a year, nothing happens, we are not lazy. I have manuscripts when I have 12 reviewers rejecting. Some reject automatically, some do not, some reject after 2 weeks, some accept but never submit and then I assign another 2 reviewers, and then I start inviting my colleagues, telling them, please, Mary, could you please review it? And then she rejects it because she doesn't even open the email from seeing that this is invitation to review, so she doesn't see that this is in fact from me. So I need to call her or him or email her from my personal account and tell, could you please open this email? So we cannot push everything to reviewers. So we have those painful text rejections when sometimes a week after submission you get, we are so sorry we cannot publish. Then reviews, final decisions, and publishers' editions. And this is, I need to be very clear, this is my personal slide. This is not an accepted framework. But when I read the manuscript, I give grades and I give my comments to discuss during the editorial meeting. So is it innovative? Is there anything new? Will people read it? Do I trust that this is reliable? Does it translate to the other context? And I will explain all of this step by step. Is the topic inclusive? Is this anything about the topic? Now I'm talking not about the authors, the topic about inclusiveness, about cultures, about humanities, inclusion of authors. So you see, this is immediate. So this is my personal writing. When there is a submission from the underrepresented country, I put in red here. Be very focused because this may be something really important for you. But still, how many people read it? Following this, I suggest I shouldn't put X here just as a negative. I shouldn't put X anywhere. So, and then I only suggest this is only whether we should push this paper to publication. So there are a lot of situations when something has already been done in the Western context. And there should be a lot of thinking if you write a paper purely on your local context, then will people from the other countries read it? How to make this publication also interesting for people from the other countries? Does it add anything new to existing knowledge? So another study on OSCEs coming from another university, how effective it is super important for your school, for my school, but this is not important for me. It may be important for Poland or for Hungary, but not for general audience because we are just fed up with papers on OSCEs. So what are the main reasons behind desk rejections. So first of all, and these are very particular. I hope this may be helpful. So first of all, if the scope is very narrow, if you want to publish anything on new course in kidney diseases, most probably this will be much more publishable in a kidney diseases paper journal, because they don't publish a lot of education. When you submit to them, they will say, oh, look, someone implemented new approaches. When you submit it to us, we are thinking, will this course on kidney diseases inform people who teach biochemistry, postgraduate courses? So, first point, very local, but then there is this yin-yang balance. It may be local if this is very innovative, if you try something extremely new. But there is a very easy way to deal with too local, invite people from the other countries. It may be very local for Poland, but then if I invite people from Central Asian republics, from Hungary, and from another country, it becomes really interesting, because then we can compare between our countries. So students in Poland are more focused on this, but in Sri Lanka more focused on this. Why is it so? This is very sad, but this is related to the fact that for many universities, people who submit the manuscript are in fact clinical teachers with not much experience in health professions education and health professions research. They read mostly medical journals, and then they see something like learning styles, and they don't know it's outdated since 2000 at least. So when I see the submission on learning styles, I think, oh my God, I'm happy that you read this paper, but this is, we know there are tons of publications, don't use learning styles. Miller's pyramid, and so on and so on. And some theories are just disqualified. Do you know how many people in their PhDs even, Dale's cone is this pyramid which says, if you memorize, only 10% will remain, 20%. If you do, this is hoax, this is fake. There are papers explaining how it happened. Professor Dale at one conference mentioned just the concept that, you know, I believe that, and people started quoting him and people started adding percentages. He never developed those percentages. And then I see a PhD which quotes, and yesterday I was just I was reviewing those slides and I found a lot of very serious looking publications using the Dale's cone without indicating that this is a false theory, wrong methodology, and I need to tell more about this because this is one of the key issues. In health professions, we are mostly working in the positivism paradigm, clinical trials, reliability, and quantitative research. In health professions education, we are working within constructivism, so we are doing the qualitative research or mixed methodologies. And I know now for many of you, this is absolutely obvious. You are thinking that I'm telling you banalities, but for many, when I see how many submissions I get which try to clone clinical trials or are focused on statistics, sometimes I get a paper which is, I'm so sorry for them because they did a huge job. They are calculating percentages. They are using very sophisticated statistical method, but it's just not the methodology for us unless you are working within psychometrics. So biomedical research and social medical research follow different paradigm theories, methodologies, and quality criteria. Also, people do not realize that research in health professions education has similar focus on quality as research in medicine. So they think that, okay, so I will just collect 50 students, I will ask them a few questions, I will use a survey. No, this is what we've been doing long time ago. There is nothing so practical as a good theory, because now if we publish in health professions education, you need to start from stating what is the theoretical framework. I don't want to discourage you. I only want to encourage you to dig a little bit deeper, so to understand the concept of research in health professions education. And this is what I started from. Every university, and now you may come from universities when you have an army of specialists in health professions education or medical education, but you may come from the university where your people maybe get the training in health professional education, but you don't have people like myself, for example. I'm telling like myself, not just to show that I'm special, but just this is for my university. It was not easy to convince that we need a team of people, and not a big team of people, who are just only working within health professions education and do not work on health professional education between trainings at the hospital, being the resident, and so on and so on. So if you are a resident, find a person that knows the theory of research. So full evaluation framework, satisfaction surveys. If you know surveys, if you know the Kirkpatrick model, satisfaction is the lowest level of satisfaction of evaluation. There is a very serious but funny research when students get the same training like we in the same group, but in one room, it was even the same teacher later on, but the same teacher for the second group brought candies, tea, and coffee, and the evaluation was much better. So satisfaction survey, if this is only the huge research, we have developed new curriculum or whatever, and here is a satisfaction survey, it will not get published. Self-assessment of learning outcomes. Here is also another very serious error. If you ask only students, how much did your knowledge increase after this session, this is extremely misleading. Because let's imagine the course on cultural diversity, obligatory. There are some people who hate it because they think that this is useless. They will come to this course telling, I know everything, and they will tell you, I learned nothing. If there is a person who is really interested in this course, even if this person knows a lot, this person will come in humbly telling, my knowledge is very low. And probably after the course, will tell, okay, it improved, but I still need to learn a lot. So unless you supplement, of course, it's important that the person believes, I wouldn't like to get, I hope I don't need it, but the CPR from a doctor who was only asked, are you good now in CPR? So we need to verify it. Often I'm a little bit, I hope no one gets offended, because there was a mention to COVID. We need to publish very quickly because, you know, social media result in spreading information extremely quickly. And people start writing, doing research in this area. So if we publish anything on COVID 3 years after COVID, just no one wants to read it. We need to be, there will be a slide at the end. You need to constantly scan horizon, but if there is really something good, don't hold it. Don't tell, oh, now I'm busy with something, I will publish in 3 months. And I will give you an example of this again in a moment. Replicating the study in another context, it's not sufficient. But you know what is when we had the editorial meeting? So when we are really struggling, okay, shall we or shall we not? The main question is, what are the conclusions? Will these people, did they do a huge job, but the results are we need more research? And then the decision will be probably no. Or will you read anything, learn from my paper, anything? Will you take a note? Oh, this is, you know, how often is that you read you scroll to the paper, but then you find the paper, and oh, I need to remember this. I need to download this. Salami slicing, this is what you know. Loud transferability. So think, how does it make interesting, appealing to people from totally different country? Low applicability, and not the journal scope. This is another issue. Sometimes, again, I don't even know how could I help these people. Sometimes I get a paper that it doesn't fit medical teacher, and I have no idea. It's not bad, but we cannot publish it. But I don't even know what would I advise to these people. Misleading title, it's just creating, it's not a workshop on writing, but good title is really important. I wouldn't be too creative, I would be very informative. Because of course it's nice if the paper starts from Pride and Prejudice and then something, but then we are verifying how does it apply to the publication. What authors, this is what I told you that about hot topics. What you cannot see is that sometimes we get simultaneously submissions on the same topic. And I can give you an example. A few months ago, I got a paper on, I have forgotten the trauma-informed care. Trauma-informed care, some people know it, it's not about trauma medicine. Trauma-informed care is about dealing with patients who went through all their lives through trauma of racism, discrimination, bad health services, how to see this in patients. So we need to be sensitive. It's a very new thread in teaching students trauma-informed care. If the patient is being rude to you, the patient is probably being rude to you because previous doctors or nurses were rude to them. And the patient is already scared. So I got this manuscript. Oh, this is interesting. We are pushing it to review. But then the next week we are getting another manuscript. In 2 weeks we are getting another manuscript. I don't know, maybe there was a conference a few months ago on trauma-informed care. But now, one paper was published. I'm sure that 2 other authors, they will be very discouraged when not only they saw they got rejected, but then when they see the publication, they may be saying like, why did they reject? Because they were first and they wrote a good paper. So, but there is what does not result in desk rejections is imperfect English. Of course, it needs to be understandable. It needs to be clear. But don't worry if my English is very far from so-called, you know what's received pronunciation. This is listening how Queen Elizabeth was speaking. This is called received pronunciation. So, of course, it's not my English. So, but if this is readable, if this is clear, then during the final edition, it will all be fixed. Now, this is the problem of the reviewers. To have papers, manuscripts accepted and understood, we need reviewers from every region, from every country. And reviewing is one of the best ways of learning. If you need to write a review, you will learn how to write a paper. So please, if you would like to review, encourage your colleagues to review. This is the very good first step, but also you will support your colleagues from underrepresented regions, not by pushing their papers, but by understanding what the context. So become the brave Wonder Man or Wonder Woman. So there is this lack of confidence in submission, but there is also lack of competence. So both need to be addressed. About confidence, I can tell you, absolutely submit. Feel we need your publications. About the competence, let's think. So first of all, I said cooperation. This is really basic. And trust networks. And it's not AMI is not a business organization, so it's not commercial. Whenever I join any conference with my team, I always arrange a meeting at the end of the day, and I ask everyone, who are the people, they know it, they know that I will ask it. Everyone tells, who are the new people that you have met? Where do they come from? What do you know about this? And how did you discuss with them opportunities for cooperation? And we have very perfect outcomes of this strategy. Previous conference, we met lovely team of colleagues from Georgia. Next month, 3 of my people went to this university and 2 of them came to my university. So just develop these links, invest in specialists in health professions education who would lead research and innovation. Have one person. You may be the cardiologist, oncologist, resident in any area. Remember that in many countries, again, I know people from UK, for you this is obvious, but in many countries you may be a surgeon, your PhD may be in surgical education. But then you need a colleague who will support you with all methodology. Avoiding clinical trialing, following the quality criteria. This is the key. Just as I said, every problematic paper, we are looking at this section, conclusions and learning point. Being up to date with developments in research and education. And again, because if you are a clinician and let's say, maybe you start implementing some new forms of examination, but your colleague who is a specialist in health professions education will tell you, okay, OSCEs come from 70s. We have the other methods now, so let's focus on the other methods. Constant horizon scanning, being very, very open to what is new and publishing in this new area. So I think if you have any comments, any questions, please. We have also time during lunch. If I only get anything vegan, which is not very difficult in Hungary, dear Hungarian friends, so then I will be all the time with you. Otherwise, I will run to the food shop to buy something. Yeah.
Thank you for your presentation. Very interesting. Indeed, I attended AMI in Glasgow last year. Not this year. I could not go, and it was interesting, quite broad. So, a couple of points. When you mentioned about the difficulty of finding referees, I also have that experience. I mean, I had some editorial roles, and indeed, it's very difficult. You end up very often to ask personal favors to good colleagues that you know. Can you please? So I think really academia should reflect on that, and because peer review, I believe in peer review is a good system. I think Churchill at some point said democracy is not perfect, but nobody invented anything better. I think this also stands for peer review. I mean, it's not perfect, but it is a good system. It is a good system if the referees are good, and there are many criteria. And nowadays, I think we are struggling really with availability of referees. People are super busy, and so as you know very well, I'm sure Pablons is an attempt, to do that. So Pablons is a system, maybe many of you know it, in which you can actually have some kind of reward. So when you are a referee, you get some points in Pablons, etc. But somehow also they not fly. So I think in general we need a general reflection on how to reward referees in a proper way. I think each of us, when we publish, when we get cited, we like it, and then our profile increases. But if you do work as a referee, basically that's a bit invisible, and so it doesn't. So this is one point. And then the elephant in the room is artificial intelligence. What is the position of your journal in relationship to artificial intelligence? Are you afraid that some papers may be written by artificial intelligence? Thank you.
The first part of your question, both are interesting. The first part, I want to thank you for bringing it back to the conversation. If you are already a reviewer, please invite your younger colleagues to review with you. For many journals, there is even in this reviewer form, there is a field to give the names of trainees in reviewing. But otherwise, you need to contact the editors, and you may say, I will be happy to review the paper, but can I bring my PhD student to this? It is very delicate. This is very sensitive because it's about confidentiality. So you need to also start from training, let's say your PhD student in confidentiality. You need to be sure that this person will not just take the manuscript and publish it elsewhere. But this is our duty. So if you are not reviewing, start reviewing. But if you are reviewing, please bring your colleagues. Artificial intelligence is, I would say, discussed not at the level of the journal, but at the level of publisher. I think I will join this team from Taylor and Francis, I hope soon. I'm not on this team at the moment. We have a lot of conversations, and as for now, we have, we don't have the final policy, we have the preliminary policy on this, but this is still in the phase of development. This is really extremely difficult. I'm all the time discussing this, but I cannot tell you anything, tangible. This is the problem we are dealing. When we started discussing artificial intelligence, there was a very short time. 2 years ago, there is also the European organization called EMSI, Association for Medical Schools in Europe. 2 years ago, it was the meeting was in Berlin, which is my most favorite city. And 2 years ago, I exactly remember the conversation when people were telling, oh, do you know ChatGPT? Some people were telling yes, but some people, no, tell me more about what's ChatGPT. And then after a few months, we are all submerged in artificial intelligence. But also for Poland, we are currently developing the standards for academic standards for fair use of artificial intelligence, but we don't have it ready. Please.
Thank you so much. It was such a fantastic presentation. A couple of things, which come to my mind as you very beautifully showed the geographic distribution, the countries, and also spoke about the Global South and their perspectives and participation. I was just, because some of the work that I have done is around gender. So it would be great to know, in your experience, how, what are the challenges and how do we see the gender disparity within the health workforce as they are applying for research grants, as they are coming in as lead authors, as they're coming in as peer reviewers and all. Because I see that as a very big challenge in promoting the health R&D in subjects which are women-related and are potentially the reason behind less understanding of the treatment, the differences that the women health conditions or the approaches to treating them, and for the gender health gap that we see. So these are all, they come down to that. So wanted to know about, your perspective around that. You spoke about competence and confidence, and that brings me to something that you touched upon in terms of, taking the junior people along. But if there are some programs to help build the competence of researchers, young researchers in the Global South, to promote, because we see very few coming in from the Global South, and we've seen your geographic distribution also indicating that. So I'll just pause here for these.
I will answer the second question first because it's easier. Well, the answer is easy, but the problem is very serious. For last AMI, three weeks ago in Basel, we had a very specific workshop on the same topic, much more clear how to support Global South colleagues in academic writing. We were all worried because these workshops are usually totally overbooked, 4,000 people. Yes, so we booked a larger room, and there were just 5 people, and 3 of them were from UK, and the audience of AMI is extremely diverse. And we had all editorial office, including Professor Ronald Harden, who is just like the god of medical education. It's a very it's an older person who's now currently retiring, but everything he says, he's super bright. And they were just, I don't know, I couldn't come, to people I didn't know and ask them, why didn't you come? So we are definitely, this is not the direct role of the journal to organize workshops, but we are still trying at conferences, especially that we are the AMI journal. About the gender, you could see in this, my very private quality criteria, there was inclusiveness of topic. Of course, for majority of papers, gender is only for the statistics. 50 women and 40 men participate in this study with no conclusions. So we need this shift to bringing gender as a leading topic of research in health professions education. And we also get sometimes from Global South papers, which are amazing in putting gender to the front line. However, because all the political, religious complexities, sometimes the message is not as you might expect to be. Definitely, we are very careful about this, but I want you, when we join the team, one of the next sessions will be the section of women's health, and there will be, this is accidental, this is so funny, I didn't know, but unfortunately Peggy is speaking online, but this is my very, very dear friend, Peggy Maguire, who is director of European Institute of Women's Health, one of the leading people in Europe speaking for bringing gender to the top level area of interest in health research, including health education. So please ask her any question that, because she's a million times more competent than I am. So I think if you, just I said, we can continue absolutely during the, do you have any? Please, yes.
Thank you, sir, for the presentation. It's a question on what you had put about rejection of papers and about methodology, and qualitative versus quantitative. Please could you expand? Because my concern is, yes, quantitative research is, especially in medicine, considered gold standard. But the value of quantitative research is based on the variables that the researchers predict or are interested in. It doesn't bring in variables that may be important, that is not identified by the researcher. So when you say qualitative, why do you say qualitative? Is it a wrong methodology?
It's a totally different methodology. Okay. Qualitative research is a totally different methodology, totally different study groups, totally different data analysis. Qualitative, if I can give you this, first of all, we have no time for this. We cannot replicate the methodology of clinical trials for education. We don't need that kind of methodology, and it's just not working. But also, let's say that someone develops a survey and distributes it to 100 or 300 people, and for large countries, we get sometimes for 10,000 people answers. And then I'm asking a question, how did you develop the questions? I'm the researcher, I ask the questions. No, you are the researchers, so you should at first ask people what are their problems. And this is the qualitative research. At first, we talk with you, and we make a qualitative project to identify what are your problems with publishing. And upon this, we can generate the questions, and we can continue with quantitative research to send it to all conference. And then, if you want to show it to your government, of course, you need to have numbers. But this is the right, qualitative research is about respectfully listening to people instead of turning them into experimental subjects. Thank you very much. There is, but if you want, okay, we have last very short question, the colleague at the, in the last row, and then I will leave you free for lunch.
I have just a very short question. In this journal, is there any frontier in terms of teacher mental health, teacher well-being, or it's just focusing only in the medical teacher curriculum?
You mean the specific journals?
Yeah, no, I mean this one, yeah.
I think there is a list about 50 generally journals in health professions education. From these top 3 level to really good journals. Also, sometimes the national journals are really good, like the Netherlands, the Dutch journal. I don't remember exactly the German one. So, and then they have specific areas. So you need just to search for this. But if you are talking about well-being, if you are talking about this area, you may also consider submitting to psychological journals, to journals focused on this. Okay, I think we need to finish, but the conversation is open. Thank you so much for being there.
All right, I think we can get started. So my name is Hannah Peacock. I'm head of SDG rankings at Times Education. I work within our data team. I've been working for THE for 5 years now. So I was there when Impact Ranking started. I've been working on it ever since. I've seen it grow from just 400 so universities to now over 2,000. So it's been an amazing project to work on that I continuously love to work on as well, because it's an amazing ranking in itself based on sustainability. So today I'll be going through a masterclass on what the impact rankings are, why we created them, and then more specifically going into SDG 3, which is the topic of this forum. So I'll first start off with what we do at THE. So THE has always been there to help students find the right courses or universities to attend to help universities understand their mission, to help universities as well deliver on teaching, innovation, and research. And this is largely done through the data that we collect through our rankings. So we have three main areas of rankings and data that we collect. We have our World University Rankings, which is focused on the research mission. And as it's focused on research, there are certain eligibility criteria to participate. So that's having a minimum 1,000 publications over a 5-year period and making sure that you teach at undergraduate level as well. We then have our teaching rankings. So we have various different rankings under this. We have our Sub-Sahara University rankings, Japan University rankings, and our online learning rankings, which is very new. We only started collecting data back in March, and we'll be debuting it in December time. And then if we focus on innovation, we have our impact rankings, which were launched back in 2019, and they turned into the world's largest global sustainable development university rankings out there. For this one, it is based on sustainability, of course, but more specifically, the Sustainable Development Goals of the United Nations. So what are the Sustainable Development Goals? They were created back in 2015 by the United Nations, more so for governments and communities to be able to build a more sustainable future. With this, they created 17 different goals covering various different subjects as SG1, no poverty, SG11, sustainable cities and communities. We've got SG3, good health and well-being. So various different topics covering 169 targets and over 230 indicators. So as these goals were created for more governments and communities, why are universities relevant in addressing these goals? Well, first off, there's a university everywhere around in the world. Every region, every city, town has a university. And there's an estimated 35,000 plus universities across the world. Secondly, universities deliver on research as well, which has been discussed thoroughly throughout the whole SDG Forum Today conference. They teach the future generation as well, so already they're making strides towards the future. And then finally, universities in their own right are economic drivers as well. So based on this, universities are key in addressing the Sustainable Development Goals and can play a key part in doing it. So that's why we created the impact rankings, to be able to measure the progress towards sustainability. So it was created back in 2017, and what we wanted to keep in mind when creating the rankings was equity, because universities around the world face different challenges. So we have applied this when creating the questions that we ask universities. We also wanted to make it as inclusive as possible as well. So there isn't any minimum research criteria like our other rankings. It also can allow undergraduate or postgraduate only institutions too, which is quite different to our other rankings. So it doesn't matter how big or small your university is. We just need to make sure that it's an accredited university and teaches at higher education level. So the first edition was released in 2019. So back in 2019, we only have 11 SDGs that we covered, and we now do the whole 17. There is an individual ranking for each of the 17 goals as well. We focus on driving continuous improvement too, because that is what sustainability is about. When universities have achieved a certain goal or target, we look into making it more complex or moving forward onto the next one. So this is why we continuously review our methodology. We receive feedback from universities as well to see how we can improve certain indicators. And we also have an advisory board as well to cover all these different changes that we want to apply. For the impact rankings as well, it can make sustainability a strategic focus for university leaders. So what universities have come back with us is that they've been able to use the impact rankings as a framework to address the goals. By reviewing what they have data for and are good at, and what they might be lacking to then improve on later on. So there's 18 different rankings. It is a massive, large ranking, one for each of the SDGs. And then we also have an overall ranking as well. And to participate in the overall ranking, you do need to participate in minimum SDG 17, and 3 other SDGs as well. And the reason we chose SDG 17 is because it's Partnership for the Goals. It covers all of the 17 SDGs, And it talks about collaboration with governments, other universities, NGOs. So we thought this was quite important to add as a minimum requirement for the overall ranking. We collect data from universities themselves, so it's all free entry data, and we also collect data from Elsevier using their Scopus data set. So this is in terms of the research metrics. So what we've done and what we've got on the screen here is specifically SDG for the UN targets. And these don't necessarily cover anything that is related to a university. This is covering early childhood development, lifelong learning, continued education, nothing so much that is addressed to universities. So what we've done is we've reviewed these targets very carefully and translated them in a way so we can ask universities and measure their progress instead. And the way we've done this is by using a framework that we call theory of change, which covers 4 different aspects. We have our research aspect. So all universities, or most universities, conduct research. And a lot of the work that they're doing already on research can be related to the SDGs. So a publication going out on renewable energy is directly related to SDG 7, which is clean energy, and can even be related to SDG 13, climate action. We then look at stewardship, so what universities are doing with the resources that they're entrusted with. So this is the campus, where the university is at, and then also their physical resources, such as the staff and their students. We then have outreach, so how are universities interacting with the outside world, not just within their university doors. So a university collaborating with an NGO or an external hospital, that is outreach. And that is what we would like to also see and apply to our questions. And then finally, teaching. Universities teach as well. And how do they keep sustainability in mind when they're addressing their students? How can they deliver on quality education as well in their courses, or bring awareness on certain subjects relating to the SDGs? So I've mentioned we collect data from universities, but we also collect data from Elsevier using the Scopus dataset. So this image is a little bit outdated from 2020, but we can see the publications that have been mapped out to the specific SDGs. And the way they've done this is they've used machine learning and specific SDG queries or keywords to then review the publications and map them out. A big percentage, so 46% of it, is related to SG3, which kind of makes sense because there's a lot more medical research and clinical citations out there as well. And then the ones that are more lacking, SDG1, no poverty, we can see where we can focus our efforts on when it comes to research. So when choosing the SDGs, and we get this question from especially new participants of the ranking, what SDGs to choose, to what represent my university. So whatever SDG you choose, you can pick and select however many you want. If you have enough data for that SDG, you will be ranked in that SDG. Because again, there's no minimum eligibility criteria. If you want to be part of the overall ranking, though, there is that minimum of 3 SDGs and SDG 17. And the way to choose which SDGs to participate into kind of depends on the university itself. I can't really tell you participate in this one and this one because I think they're more important. It is sometimes an opinion-based thing. So for specialized institutions, I think here today we have a lot of medical universities. They do tend to participate in SDG 3 to see how they're performing in this specific one. So that can be based on the institution's mission. It can be regional as well. I'll be going through some slides on what we see in Europe and where the priorities lie for different SDGs. Or it could be relevant to the activities done at the university. So if a university is doing a lot of progress towards educational resources for the general public, that is very SDG 4, exactly what we asked for there. So I do have a link here, but do feel free to reach out if you want, of an SDG quiz that we released a couple months ago. It kind of asks about 5 different questions per SDG to see which ones you have enough data for and you could likely perform well in. but it can also be used if you're lacking in certain data on where to improve your efforts in producing more. So we've recently opened up the data collection for the portal this past Monday, which I'm very excited about because we're headed into the 7th edition of the impact rankings. I can't believe I've been working on it for 7 editions already. So this is open from Monday to the 11th of November, which also falls on a Monday. And then it's followed by a period of validation. So what we do is if you have never participated before, send us an email, we register you and add you so you can access our data collection portal. And from there, you can enter your numeric data and your evidence data as well. For the numeric data, we do go through a period of validation, typically around December, January time, where if any of the data gets flagged for universities, we reach out to them so we can either amend it or get evidence that the data is accurate and representing your university. So this is quite important because we deal with a lot of universities, over 2,000 participated, a lot of data that we collect, and we want to make sure that the data is accurate as possible, so we do go through validation. But it is also up to universities to follow through and make sure they're providing the right data, but also letting us know and responding to us when they don't. So for evidence data, which is the other thing that we ask universities, and without impact rankings, it was the first time we were asking for qualitative data from universities. And this is partly because there are certain UN targets, like asking for the smoke-free policy. You can't really ask that in numeric values. So we asked the university question. The example that I put on earlier, does a university as a body offer free educational resources for those not studying at the university? And then there's additional details as well. So you could enter yes or no, or you could do free access or charged access, and they would be scored differently. You then would provide a piece of evidence, which is not mandatory because, again, we understand some universities do struggle to collect the evidence as well. But our team of validators go through this evidence, and depending on the relevancy, it would get a score or not. So if it clearly answers the question and addresses all the points I asked in the question, it would receive 1 point for specific. If it is a bit more general, doesn't fully answer the question, but there's something there, it would get half a point. And then if it's not relevant at all in our eyes, then we would get not relevant. Only once we have reviewed if it's relevant or not. So if it's relevant, we can then determine if it's public or not. So public evidence is a URL website, the university website, which is typically the evidence we receive, or a news article. It can be third-party websites too. If we can access it and we don't need login access, it's not private or needed on the intranet of the own university, it can receive an extra public point. And the reason why we've given this extra point is because we want universities to not just show us their progress towards sustainability and that specific indicator, but we want them to show the world outside of the university as well what they are doing. So here we have the latest Impact Rankings 2024 analysis. So we had 2,152 universities ranked in the past 2024 release, which was back in June, and it was released at the Global Sustainable Development Congress in Thailand. So the ranking as itself has grown massively, very quickly. We cover 125 different countries or regions. There's over 250 different metrics that we cover across all 17 SDGs. So again, we collect a lot of data for this ranking, and we recognize that. There's over 283,000 documents that we received and reviewed by our team as well. So that was over 30,000 plus human hours to review all of that evidence. And with that, it can be sometimes a struggle. I had a team of 65 people reviewing all that evidence within 3-4 months, trained and on our validation guidelines, going through the different languages as well, because we hire different language skills so we can review the evidence in local languages. Because again, we want to be inclusive, so it doesn't have to be in English. So a lot of work and effort has gone into the impact rankings, but we still want to make sure that it's as smooth as a process for universities and completely free to participate in as well. So here's a world map of all the participating countries. So I said 125 different countries and regions. We've almost beat our other ranking there in terms of numbers, but there is a good spread in the global north and global south of participating regions. We hope to eventually be global enough, covering the whole map, but we do get to see a lot of different data across the world as well, which is extremely interesting to find out more on. So talking about finding out more on, here is the Europe participation. So if we see the line in the middle, that's the world average, and then it's participation based on SCG. Wherever it's higher, it means that Europe participates more in it than the world average. So it's quite interesting to see where the different priorities lie for each of the regions as well, because we do see something completely different for Asia or South America, for example. So the most participated SDG is SDG 16, peace, justice, and strong institutions. So it's more about policy making and collaboration as well. We then have sustainable cities and communities, which is also a big one around the region. SDG 9, innovation and infrastructure. SDG 10, reduced inequalities. I could list all of them by memory. But the least participated ones are SDG 1, no poverty, because it's not as much of a priority to tackle it, because there's not as much poverty around this region than there is in others. And then SDG 6, which is clean water and sanitation. We believe it's for the same reason. And then if we look at the scores as well, we can see in the other slide, SDG 10 there was still quite high in terms of participation, but when in terms of scoring, it also scores quite highly. So that's reduced inequalities as well. There's a lot of gender-based policies out there and diversity committees in Europe. And we do see that with the evidence that they provide. Not so much on SDG 6, but again, they don't tend to participate in it. But we also get good coverage in SDG 8, decent work in economic growth. And then if we look at the participation in each SDG for Hungary, specifically, as we are here in Budapest, we've got on the left side the worldwide, and on the right side Hungary specifically. So SDG 4, which is quality education, is the most participated SDG for Hungary, and it tends to be for a lot of different countries. It's the most participated SDG out there in the whole ranking, apart from SDG 17, just because that one's mandatory to participate in. So we get a good difference here and where the priorities are for the specific region. So SDG 8, decent work and economic growth. SDG 11, sustainable cities and communities. And SDG 15, not so much 14, but 15, life on land. Here we see year on year the difference in participating unis. A surprise, there's not been much difference. There's still 11 universities participating year on year. We're hoping with this SDG forum as well, we'll get more participating unis from the country. But you can also see there that SDG 4 and 8, 11 and 15 are the most participated in. Then when it comes to schools, SDG 8 with 7 universities has the highest score there. And then looking at the different box plots and averages, medians rather, Hungary versus Europe versus the world. So each of those dots are a university. And then on the higher scale, it's the top scoring university. On the lower scale, the least. And that line in the middle is the median. So we see that it is very similar for Europe and for the world. So for Europe, Hungary is slightly lower, but compared to the world, it is higher. And we can see the same specifically for SDG 3 as well. There's 3 universities that are quite high performing for Hungary here, but still producing slightly lower than the median for Europe, but higher than the world median. So still quite a good feat for Hungarian universities. And then if we dig a little bit deeper at the indicator level, so this goes through the line in the middle again is the worldwide median, and we can see what they're performing good at and what they're performing badly at. So on the right-hand side, we can see that research is very well done. They tend to outperform the worldwide average. But then when it comes to the educational measures or health services and more of the evidence data, it is lacking a little bit more. So with this, we can see where the efforts can be done to improve. And now I'll be going through SDG 3, good health and well-being, more specifically. So over the past few years, we've had an increase of 73%. That's 871 universities back in 2021 to 1,504 universities in 2024. So already over 1,000 universities is a whole ranking in itself. It's a lot of universities that have participated. It's the third most participated SDG out of all of them across the world as well, after SDG 17 and SDG 4. So it does get a lot of coverage and has grown the fastest. I would also say it is a little bit of the more easier SDGs for universities to participate in too. So where are the top 20? We have 8 universities around Asia. In the top 20, 7 in the APAC region, 3 around Europe, 1 in the Middle East, and 1 in North America. If we look at the top 10, we have in first place, JSS Academy of Higher Education and Research. Second place for the second time running, Australian Catholic University in Australia. Mahidol University, Thailand in third place. Vegeta Health University in fourth place, which have actually come off to the event as well. RCSI, University of Medicine and Health Sciences from Ireland, we had them earlier too, they came in fifth place. So the one thing that I do really enjoy about these rankings and how it's different to our research rankings is that there's a little bit more diversity in terms of the top 20 or top 50 that we see in the ranking. So in this one, we do see India, Australia, Thailand, which already there's quite difference. In research-based rankings, we see a lot of English-speaking universities there from the Western world at the top. So here we have Lithuania, India, Taiwan as well. And across most of the SDGs, there's a lot of diversity, even in our overall ranking. So if we go in SDG 3, this is one of the SDGs where we only ask for 3 metrics, so not that many. It is one of our shorter SDGs. We have our research metric, which is what we ask for in every single one of our SDGs. Although there isn't a minimum research requirement, it does count for 27% of the SDG. We then ask for number of graduates in health professions as well. So this is numeric data that we ask for to see what the universities are doing in terms of output into the workforce for health graduates. And then we've got collaborations in health services where we ask for evidence-based data. So earlier I was talking about the theory of change where I covered research, teaching, stewardship, and outreach. And this is how it's presented across the different indicators and data that we ask for. So the first 3 indicators are research-based, so that will always be research. Although there is a bit of outreach there as well for clinical citations, and that is the 27% I was mentioning. We then have proportion of graduates in health professions, that is mostly teaching, so that aspect that it covers, and that's 34.6%, so it is quite of a high value in terms of weighting in the ranking. And then for the rest, we've got outreach, stewardship, and then a little bit more on teaching. For example, the pre-sexual healthcare for students, we do ask if there's educational resources available as well, and that's why there's a little bit of teaching in that aspect too. If we go to the research metrics, so all the publications that we review are specifically mapped out to SDG 3 using the keywords from Elsevier. out of the total publications that a university has in a 5-year period. So we look at paper views, how many are mapped out again to SG3 that have been viewed or downloaded from the total university's output. Clinical citations, so how many clinical publications that have been cited in clinical guidance. And then the publications, we look at the proportion of publications in SG3 compared to the total publications output of the university. So with that, we look at the impact of the output rather than the scale of the institution, because we're looking more at proportion. Then for number of graduates in health professions, this directly relates to target 3.C from the United Nations, increasing health financing and supporting health workforce in developing countries. So we ask for the number of graduates in health professions and the total number of graduates and calculate a proportion out of it. We also ask for a very specific academic year, so the way we validate the data as well is year on year. And relevant professions there, the typical health professions, so general medicine, optometry, public health, but we have included mental health and psychology in this one, which is quite different to our other rankings because the subject mapping tends to include psychology and social sciences. But for this, we've been a bit more vague and included it in this specific metric. So if we look at the data that we received in the past ranking release, we've got another box plot here, just in a different format. So the median there for the worldwide is around 50. But then for Europe, it is slightly, ever so slightly higher. But we can also see that the world has a bit more of a wider range between the lower scale and the higher scale too. So overall, Europe tend to perform better in this number of this metric. Then for collaborations in health services, so in this one, we do specifically ask for data, proof that the universities are taking action towards these goals and targets. So we cover all of these different targets, 3.4, 3.7, 3A, 3B, 3C, 3D. We ask universities if they have collaborations with health institutions, so either at the local, national, or global scale, and are these health institutions external to the university as well? So if a university has their students working in their hospital, for example, which I think will be something quite common here, it wouldn't necessarily count. What we want to see is collaborations with external health institutions, and not necessarily their students, but the university as a body doing this as well. We then ask about health outreach programs for the local community. So again, not inside the university itself and the university community, but outside. A lot of examples of this that we receive from universities are amazing outreach programs where they would go to towns that are a bit more impoverished and not non-developed. And they provide these either educational resources or free testing on certain diseases. And it is amazing to see efforts that universities are doing towards this. We then ask about shared sports facilities, again, with the local public. And it can either be at a free or a charged level. Depending on free or charged, it would get different points. We ask about sexual health care services, sexual reproductive healthcare services as well, and is there any educational resources available too? So there's loads of different types of evidence we see for this one. We see sometimes universities just handing out free condoms, which is amazing, but not necessarily what we're asking for here. We want to see active, consultation or psychology, mental health support when it comes to these things, maybe STD screenings, but is there more to it as well? So again, this can be free or charged. We then ask about mental health support for students and staff. So in the 2025 methodology, we're actually separating this question out and asking students separately, staff separately. A lot of the time, universities offer mental health support for their students, which is amazing, but they don't necessarily do so for their staff. And we've been discussing today that that's important as well to build up the morale of students, is that the staff have to be okay too. And then we asked for the smoke-free policy. So this can be either a completely smoke-free campus or smoking in designated areas. And for this one, a lot of the evidence we receive, and we recognize that smoking at the moment tends to be a national law. You can't smoke in buildings, which we're very happy that's passed through. But what we want to see and what we ask in every single one of these questions is, does your university as a body do these actions? So when a university publishes a link to a government website saying this is the law, we don't smoke in public buildings, that wouldn't be enough. What we want to see are the universities actively acknowledging the policies that they have in place. And again, if they make it public, they would get that extra score as well. So if they reference on their website, we follow this law, it will probably receive just half a point. If they have their own smoke-free policy covering this, then it will mostly likely, receive the whole points. So here is an example on if universities provide students with access to mental health support. This is from Kaunas University Technology from Lithuania. So here we can see on their university website, they provide psychological support for their students, and it is free as well. They have certain questions there, if you have stress, anxiety, lack of motivation, but the students are able to see this, register, and be able to get their consultation from a psychologist, it's great to see. So this would be an example of best practice. Then we have Almaty Management University from Kazakhstan. So we asked about a smoke-free policy, and this one, they haven't just uploaded a PDF, they have made it public on their university website as well. And they just cover that, yes, they follow the law, but they've made their own university policy as well covering anti-smoking. So I have discussed with some of you if you participated in the rankings before, and I think most of you have already participated in the rankings. So I just wanted to go through some of the methodology changes, which I've not added on the slides, of 2025, because we have opened already our ranking. So one of the main changes that we've made is we switched from accepting 2 pieces of evidence to just accepting 1 piece of evidence per indicator. And the reason for this is because the numbers that I showed you earlier, 283,000 documents, the more we're growing, the more workload it is, and also for universities too. So we wanted to make that easier on both us and you universities. So the submission process should be smoother and take less time to process. We're also using AI, which has been mentioned multiple times today. AI has been the main subject I've heard of during this whole conference, but we're using AI to help with the validation as well. So we applied this in our quality assurance checks in the previous edition, and I'm happy to go through more of it if you have any questions, but basically we trained AI with specific prompts, just the way that we would train our human validators. And we're going to be doing a hybrid process of AI, seeing if evidence is relevant or not. If it's considered relevant, then it goes to human validation to see if it's specific or generic. And then whatever can't be scanned, if it's an image or document, that will still be validated by human validators, or if there's not enough text. And then there will still be a QA process as well on top of that. If you received 4 points last year and the AI's recognized that it's not relevant this year. So it's been quite exciting, and we've been working very hard on this AI validation process, but at the moment we've seen that it's more accurate in some cases, because it kind of gets rid of that human bias that we sometimes have. And then it is also more consistent as well across the whole validation, which is great to see. So that's how we're able to keep up with the workload and the diversity of documents that we receive. So I'm going to finish up with this quote from Tanya Rhodes Taylor, the Executive Director of Communications from King's College London. The THE impact ranking should be celebrated for providing a more level playing field that allows a much broader range of universities opportunity to demonstrate the positive impact they make beyond traditional rankings. So if you haven't participated before, there is a QR code there as well, if you're interested. There is time for questions as well, if anyone has any questions. Over there.
My name is Krishna. I'm from University of Hertfordshire, UK. I've got a few questions. My first question is that does that ranking link to HE league table?
The SG table?
No. Does that this your exercise does link to the HE league table of the UK, like in terms of ranking the students, the universities?
Yeah. So this link links to our registration page for the impact rankings.
Okay. The second question is that you mentioned one of the slide about research metrics, and you said that you use a keyword. So I just want to double check. If I want to do the same thing, what kind of keywords or key terms you expect us to use it so that we'll have the same output?
Yes. So this is done by Elsevier and on their Scopus data set. They do have, and in our methodology as well, we have a link to the keywords, but there's about 200, 300 of them, so I won't be able to let you know all of them, but it tends to stay the same year on year. So the most recent change is on SG3, they added more terms in term for COVID-19. So if there was a publication on COVID-19 vaccines, then that would be directly related to SG3 that uses the keywords. And we look at Elsevier look at the abstract mostly, and they're able to do that with machine learning. So it is a constant improvement process as well. But if you want to read the keywords, it's in our methodology.
Okay. Last one.
Of course.
Based on your slide, if I'm not mistaken, I think that 873 universities participated altogether?
2,152.
Oh, okay. So it's still we have more universities in terms of the number, isn't it? So what are the key challenges that other universities, not all universities, are participated in this exercise?
Oh yeah, I did say earlier there's 35,000 in the world, isn't there? So I think the impact rankings still are relatively new. So they opened in 2019, so they're still growing in that aspect. But a lot of the rankings that are from the past as well have been focused on research, and that leads the pool of the universities being very small because not all universities conduct research or are able to, or they do, but they just don't do it on Elsevier. So it's a big disadvantage, and that's why in that area for a lot of the smaller universities, they've not been interested in participating in ranking. And that is what we wanted to change with impact, because it's not research driven, although there is research metrics, it's focused on sustainability, and any university can accomplish that.
Thank you very much.
Thank you so much. I'm Caitlin. I'm all the way from Australia. It was a bit of a long travel. I just wanted to know, on the slide earlier, you had the different health professions that were listed. Are those exhaustive? Or so I'm from exercise medicine, so we instruct exercise physiologists who prescribe exercise as a prevention method.
Yeah.
I just wanted to know, is that going to be recognized as a health profession, or is it just that list?
So it's not just this list. I think this is because it's the most general that we have founded. In our methodology as well, we have about 4 or 5 pages of different subjects that kind of group it up in the way we map subjects. So when it comes to specific things, I would say best to look at the mapping, but generally it should be okay to have that included in here, because the whole point of it is to be related to health. And although it doesn't have to cover these specific things, if it's related to health, we're more than happy for you to include it. another part of the ranking and why we've left it a little bit more vague is because we want universities to keep that open-mindedness and, again, allow them to be able to provide that data, because there are specialized schools that won't be able to. So yeah, that should be completely fine.
Thank you.
Anyone else? All right. I'll leave the last slide open, and if you do have any questions, I'm here all day as well, and at the gala dinner afterwards as well. So do feel free to reach out to me afterwards if you've got any specific questions. I am the main person working on impact rankings, although I have a lovely, amazing team. But I am the expert here, so do feel free to use me at the same time while I'm here. All right, well, thank you, everyone.